Welcome to the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Join us as we dive into inspirational stories about our caring and capable associates and their commitment to guiding healing journeys for our patients. Our discussions explore the important ways VCA Animal Hospitals proactively supports the future of veterinary medicine through leading the industry in medical excellence and providing hometown care to our communities. On today's episode, I'm happy to welcome two very special guests. The first is JoLynn Haller, who is a credentialed veterinary technician and a veterinary technician specialist in clinical practice. She is a technician supervisor at VCA Fairmount Animal Hospital in Syracuse, New York. Our second guest is Kathryn, or Kat, Carman, who is also a credentialed veterinary technician and also a veterinary technician specialist in clinical practice. Kat works at VCA Braylon Village Animal Hospital in Peachtree City, Georgia. Welcome, ladies. How are you today?
I'm great. Thank you so much for having us.
I'm good. How are you?
Doing well. I'm so happy you both are here, and I want to jump right into some questions. So this first question, I'll ask both of you, but JoLynn, we'll start with you. Tell me about your journey in veterinary medicine and with VCA, and tell me a little bit about your hospital and your current role.
Yeah, so I always knew I wanted to work something with animals. My mom has this little picture I drew in kindergarten of me and cats. So going through my school journey, I knew nothing about veterinary technicians. It was only doctors that we had experience with. So once I started working as a kennel attendant in high school, found the whole world of veterinary technology, and that's where I grew to love it and knew exactly what I wanted to do at that point. Saw a lot of surgery, didn't like that, didn't want to go that route. So I learned about veterinary technology and went to school. I worked in a lot of different places. I worked in general practice, shelter medicine, emergency medicine. I'm back in general practice right now. It's a nice hybrid of the general things, a lot of surgery, and emergency medicine as well.
Excellent. But you're not the one doing the surgery. You're assisting with it.
I do a lot of the anesthesia, yes. But no, I'm not interested in putting my hands in animals. I'm good with that part. So I've been a technician for about 20 years, and we've been with VCA for about 5.
Excellent. And Kat, why don't you share with me your career journey?
Sure. So like many of us in the field, I decided in 3rd grade that I wanted to be a veterinarian. And then I got to college, and chemistry, calculus, and I had a huge falling out. We still haven't made up.
Okay.
And I did some other things for a while. And then I kind of came back to it and decided I was going to try to go for my prereqs, and got a job working as an assistant with Banfield. And that opened my eyes. And I realized that what I thought a veterinarian did and what I thought I wanted to do was actually the technicians. So I started with one of the online programs and graduated and became licensed in 2015. And after leaving Banfield, I worked for a small animal private practice. And then I joined VCA in 2019 as the surgery team lead at VCA Braylon Village.
Okay.
I ended up earning a master's in advanced practice veterinary nursing from the University of Glasgow in 2021. And I actually just passed my boards.
Yay.
So
congratulations. We're gonna talk
you.
about
I'm a
that.
new specialist.
That's very exciting, and we're going to talk about that. Tell me a little bit about that master's degree. I'm not familiar with it.
I think what I liked the most about the master's program is how broad strokes it was. And it gave you skills in education. It gives you skills in business. It gave you a lot of skills in research and evaluating evidence, and really developed the critical thinking skills that are so important in clinical practice.
Oh, that's wonderful. Kat, for our listeners who might not have worked in a veterinary hospital, tell us a little bit about the roles of a credentialed veterinary technician and a veterinary assistant and a kennel help in the hospital.
Sure. So all of the roles are essential. The kennel technicians are typically providing basic care, feeding, walking, but they're also the first eyes on the patient. They notice if the patient doesn't have an appetite or if the patient's bowel movements have changed, which can be an early indicator to the medical team that something's going on. Veterinary assistants and technicians work a little more closely with the doctor. And the difference between them is technicians have typically gone to school and passed an exam demonstrating an advanced knowledge of the skills and disease processes and have a better clinical understanding of why things are going on. The best analogy, and it's definitely not the same, but the best analogy is the licensed technicians are more closely related to the registered nurses in the human field. Everybody has their own unique responsibilities. Licensed technicians teach and guide others in the hospital, and they have their own role that's separate from the veterinarian. They take on the majority of the hands-on skills and allow the veterinarian to focus on the things that only veterinarians can do, which is diagnosing and prescribing and surgery. And this team works together to communicate and collaborate and advocate for patients and clients.
JoLynn, you're a veterinary technician supervisor. When did you take on that role, and what does a vet tech supervisor do?
Yeah, so I've been the supervisor here for about 5 years, and I still am on the floor doing tech duties most of my shifts. So it just adds another layer of what I have to do. So the usual things people think is supervisors, managers do, create schedules, make sure, everybody's time cards are taken care of. We have to balance the controlled drug logs, make sure we have enough inventory of certain things, some managerial things like that.
So both of you have an additional credential. You are Veterinary Technician Specialists, which is abbreviated as VTS, in clinical practice. JoLynn, what does it mean to be a VTS, and how many specialties are there for technicians?
Currently, there's 16 specialties on the list. I know that changes every now and then, but it's growing, and that's amazing. So a veterinary technician specialist has worked in clinical practice or their field for a certain time frame. We have to work at least 5 years out of school before you can apply.
Okay.
Once you get into the process, there are certain advanced skills that you need to master and work either with a board certified veterinarian to just make sure that you have mastered the skills, not that you just can do them, that you can do them repeatedly. And then once you go through that, the credentialing committees will approve your application, and then you get to sit for the test that Kat was just talking about.
So it sounds like a pretty challenging process. Do you know how many VTS there are in clinical practice?
There's so many general practices out there, and this should be one of the biggest academies out there. We aren't very big. And it is international. There are a couple of Australian veterinary technician specialists that just took their test as well. So it's not just United States. But like compared to emergency and critical care or anesthesia, we're definitely a smaller academy in general.
Well, I appreciate that. And actually, I didn't know that clinical practice was a vet tech specialty until fairly recently. And it's one of the reasons that I wanted to have both of you on to talk about that, to increase awareness, because I think it's a tremendous opportunity. So, JoLynn, when did you become specialized, and why did you make that decision? Because it's difficult to do.
Yeah, I took my test in 2018, and so I got credentialed there. So when I was working in emergency, I was introduced to the veterinary technician specialty group because there's quite a few of those technicians who were already certified there. I didn't stay in emergency long enough to go for that one. But then clinical practice didn't start as an academy with NAVTA until 2010.
Okay.
So they are fairly new since the whole CVTS started in 1994. Clinical practice is still very new in the whole grand scheme of things. Their first test for clinical practice at all was 2012.
Sounds like your experience working with vet tech specialists in other fields is one of the things that kind of spurred you on to do that. Is that accurate?
Yes, and always learning new things. And the field is always changing. There's always more education out there. It's a good challenge to have on a daily basis.
Kat, you recently completed your credentialing for your VTS. Tell me a little bit about what that process was like and what steps were involved.
The credentialing process is going to be different based on which academy you select. Each academy has their own kind of guidelines. For clinical practice, it sounds deceptively easy.
Okay. It is
right?
not. I'm 100% sure of that.
It's like the problem is you literally have to know a lot about not a little about everything, a lot about everything.
Okay.
Yeah. So the requirements currently for clinical practice, you have to have 10,000 hours as a credentialed technician before you can apply. So that's about 5 years working full-time in clinical practice. Within the 5 years preceding your application, you have to obtain 50 hours of advanced CE. So advanced CE means that it's given by a diplomate of one of the specialties, or a VTS, or a certified veterinary pain practitioner. And then you can submit your pre-application, which is your employment history, your CE, and all of that. If you pass your pre-application, you can submit your application. And the application's kind of the meat and potatoes. You submit between 50 and 75 case logs. And these case logs are collected over a year right now it's between July 1st and June 30th. And these case logs demonstrate your mastery in, I believe it's 108 different skills.
Okay. Wow.
And the skills range from very basic, like taking vitals on a dog or cat, or CPR, anesthesia, surgical assisting, radiology, laboratory procedures, pharmacology, all the way up to euthanasia and end-of-life care. You have to pass 80% of those skills. 4 of your case logs get turned into full-blown case reports.
Okay.
Where you write up the what, the why, the how with references, and you submit 5 exam questions.
Okay.
If all of that passes, then you're allowed to study for your boards.
Okay.
And that's a list of, I think it's about 300 different disease processes. And you have to be able to discuss the anatomy and physiology of all of the major body systems, the pharmacokinetics and dynamics of a whole bunch of medications, and the disease processes of like 300 different diseases for dogs and cats. So it's pretty extensive.
Oh, that's amazing. So tell me about a couple of your case reports of patients that you turned into your case report for submission.
Yeah, sure. I had a really fun one of a case of thrombocytopenia.
Okay. And that means low platelet count, just for people who don't know what that means.
Yes. We found it incidentally on her lab work prior to her spay.
Wow. Okay.
She was diagnosed with immune-mediated since she had just been vaccinated recently. But it was very interesting to look into the causes of the immune-mediated thrombocytopenia and the lab work and the diagnosis, and then, of course, the treatment for it. Another one of my case reports, again, it doesn't sound super exciting, but it was a case of heartworm treatment in an adult dog. But again, discussing heartworm transmission, the life cycle, and then the protocols and the sort of the changes to the protocols that a lot of doctors make, and thinking about them critically and how they work, and how the adulticide differs from the microfilaricide. So killing the adult worms versus killing the baby worms. And I actually really enjoyed writing the case reports.
Well, it sounds like you learned a lot too in that process.
Oh, so much.
So, Kat, I know that with other specializations in veterinary medicine, it takes a lot of study and support to get across that finish line. Did you have access to mentors to help you along the way? Yes.
The academy will assign a mentor to any applicant who requests one.
Okay.
And I'm fortunate that I'm probably partial, but I'm going to say she was the best mentor.
Okay.
She was able to answer all of my questions and review my case logs, and not tell me how to change it, but give me feedback and sort of steer me in the right direction as I'm editing them. And then, of course, my husband put up with me for 2 years while I went through this process.
Okay. Yes, spouses are always important in board studying.
Yeah, I would not have been able to function without him. But the mentor from the academy was essential. And I'm very excited that I am now getting to be a mentor to new applicants.
So, JoLynn, JoLynn, since you've had your specialization for several years now, do you think that your patient care abilities have improved?
Absolutely. There are quite a few ways, even just to teach the new technicians coming out about things to watch for, what you're looking on blood work for, things you can alert the doctors about that you see before they see them, just to help the whole process move forward and give those patients the care that they need.
So, why should somebody who is already a credentialed veterinary technician working in primary care consider doing board certification?
Anybody who's looking to expand their base skill set, learn more things, reach out into, you don't want to be a doctor, but you want to do more than what the regular technicians are doing. So it's like licensed technicians translate into the human world closely to what like an RN does. But if you want to go up a level to be like where the nurse practitioners are, it's not the same. It's very similar to how they function. So they're just a step up. They have more knowledge. They've been through more education. We still, as veterinary technician specialists, we have to renew our credentialing every 5 years.
Oh, wow.
So
what does that involve?
Yeah, so it's a lot of staying up with continuing education, but like Kat said, you have to have it by, it's not just anybody you can get your education from. You need another VTS or a board certified veterinarian, things like that. So we're getting the new best information that we can dispense to all of our teammates. There are a lot of VTS technicians who write chapters in books and do research and write magazine articles. Things like that count towards your recertification. So there's different ways that you can use your VTS to go out and do more things and teach more people and advance their skills as well. So anybody's looking for a challenge or the next step or just want a fun adventure for 2 or 3 years once you get out there and practice and challenge yourself.
So, JoLynn, as a supervisor, does your vet tech specialty influence how you supervise?
Yeah, I was also a mentor for some of the, specifically some of the VCA technicians that are going through this program. My email is always open.
You weren't Kat's mentor, were you?
I was not. I was not. But just general questions. I'm not in the mentor group right now for the academy, but I had a whole bunch of people just throw some general questions out there. I'm always available for that. But it definitely, going through the process, all of the things that you have to do kind of shows you what other views other people might need to help them grow in their skills as well. So just how to interact sometimes a little bit with different staff and those that you can already see the spark in them, that they're ready to take off and go do all of these new things, that you can empower them to have that ability to go and do that.
Wonderful. And Kat, what inspired you to get your specialization?
I am one of those people that I want to be the best. And more than that, I really wanted to know that I was providing the best patient care. One of the big focuses in my master's program was evaluating evidence and being able to determine what the best practice is, and not always the gold standard either. You do have to think about spectrum of care and what's available to your hospital, to your community, to your clients. But just having a deeper understanding of the why, I think helps you make a better decision for the patients. And pursuing the VTS helped me prove to myself that I am practicing at the top of my game and that I am providing the best patient care. And then there are career benefits to it as well. I feel like the more you learn, the more you have a responsibility to educate others. I'm really excited to start sort of swinging into a more educator role, a more mentor role within both my hospital community and the veterinary industry at large.
So this question is for both of you. And JoLynn, I'll start with you. Why don't you share any words of encouragement for other credentialed veterinary technicians who might be interested in getting a VTS in clinical practice?
Yeah, so I just wanted to mention too, clinical practice. It's not just, I think Kat and I are both canine and feline. There's also a subspecialty for feline only.
Wow. Okay.
Production medicine, exotic medicine. Kat, tell me if I missed anybody.
No, those are the 4.
Yep, the 4. So it's not just clinical practice. Our practice is dog and cat. So, of course, I went for the canine feline. I think that's most of the practices, general practices that are out there. But if you work in a feline only practice, you can go direct to the feline only specialty or exotics, or there's only a couple production medicine. So I know I probably should have put a plug in there for those guys. But if you're working on production medicine and you want to advance your skills or looking for something different, apply for the VTS. But I think we all get into this for the love of animals. And then you start doing some of these different things you never thought you were going to be. And then a whole new door opens. And there's so many other things that we can do to help. So if you're looking for a new challenge or just want to develop your skills more, find different things to do, go on and be a VTS. Like I said, there's 16 different academies out there, from behavior to zoo to clinical pathology, nutrition, so many things you can go and do. So even if I'm in clinical practice and I am doing a whole bunch of anesthesia right now, which I am, and I wanted to go ahead and go for the anesthesia analgesia specialty, I could do that now, but get out there and try something new.
So it doesn't scare you, having gone through the process, that you wouldn't be worried about going through it again.
No, not at all. I mean, yeah, it's a lot of work, and like Kat said, you do need a lot of support, especially from your clinic family. And I know VCA supports the veterinary technician specialty groups, so get the support from VCA that you need and get some nice benefits out of it.
Excellent. And Kat, what words of inspiration would you share with your fellow credentialed veterinary technicians on taking this step, since you have recently proven that you can survive it?
Yes, you can survive it. I would encourage anybody who's interested to do it. You learn so much just going through the process, like you said, but it also helps to move the industry forward. I think if we have more people who pursue these advanced specialties, we're going to have more people with the ethos that they need to influence change and keep our industry moving forward.
Absolutely. We certainly champion our credentialed veterinary technicians and veterinary assistants and know that veterinary medicine is a team sport. I am the first one to say as a veterinarian that I am a terrible technician, and yet to deliver the amazing patient care and the quality of care that we are able to deliver in VCA. I applaud both of you. I really appreciate you. And it has been amazing to hear your stories and get to talk to you a little bit about this wonderful specialty.
Thank you for having us today.
Yeah, thank you so much.
Thank you for listening to today's episode. We hope you enjoyed it and learned a few helpful tips. If you haven't already, I encourage you to subscribe and listen to our previous episodes to hear the many valuable insights and lessons from our past guests. Don't forget to leave a review for today's episode and share with friends. Make sure to follow VCA Animal Hospitals on LinkedIn, Facebook, and Instagram to stay in the loop. For more inspiring stories, visit our website at vcavoice.com.